Hello everyone, welcome to your lecture on History of Nursing and Standards of Practice. In this lecture, we are going to cover a few different things, including the historical background of nursing and the influences on nursing practice. We're going to talk a little bit about the definitions of nursing, what qualifies nursing as a profession, the different roles a nurse plays in a variety of healthcare settings, and we're also going to talk about the effects of these organizations and standards of nursing on nursing practice. What is nursing? Nursing the word nursing has originated from the Latin word nutrix, which means to nourish. According to the American Nurses Association, the definition of nursing is the protection, promotion, optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and population. If you notice the keywords here, we have protection, promotion, optimization, prevention, facilitation, and advocacy. And if you also notice, it is actually including not just the patient, but families, groups, communities, and the entire population. However, in all nursing definitions, it's important to remember that the patient is the central focus. The history of nursing, this is a chart of the different influences of history, the historical aspects of nursing on the current nursing practice. Please go ahead and read over it. And here are a few important theories and key points of the historical influences on nursing. We have the theory of animism, where good spirits brought health, evil spirits brought sickness. The roles of the nurse and the physician were very separate and distinct. The physician is the medicine man and the nurse is this caring mother. Then you have the ancient Greek civilization. Then we had the early Christian period, where nurses gained more of a formal role. During the 16th century, the nursing shifted from religious orientation to warfare. In the 19th and 20th centuries, nursing, as we know today, began. This is when Nightingale first established a training school for nurses. Between the 19th and 21st centuries, hospitals organized schools, and the nursing now grew as a profession, as we know it now. What are the contemporary influences of nursing? We have the nurse's self-care, right? And this became especially popular post-COVID because of the burnout that nurses faced during COVID. And it's important for nurses to manage stress and conflict, build connections with colleagues, to share difficult stories, just getting it off your chest. Practicing self-care and maintaining an appropriate work-life balance are very important for nurses. Another influence that has affected nursing is the healthcare reform and the rising healthcare costs, right? It's a huge emphasis on health promotion, disease prevention, illness management, and we expect this to grow in the future. We expect this shift from emphasis on just providing, care to somebody who has the disease to promoting health and preventing disease and managing their illness for the future. Using healthcare resources wisely and effectively. This is also a very important aspect of nursing. Another influence was the demographic changes in human rights. If you notice, just in the United States, we have a huge group of the minority population has grown significantly. And there are a lot more needs for the aging population. Then the last influence on nursing are the medically underdeserved. There are increasing number of medically underdeserved due to unemployment, mental illness, homelessness, and rising healthcare costs. And we will talk a little more about this when we cover the social determinants of health. Let's talk about the aims of nursing. What are the four main aims of nursing? They are to promote health, prevent illness, restore health, and facilitate coping with disability or death. If you remember from the previous definition from the American Nurses Association that we read, these are the key words in that definition. Now, to meet these aims, what do nurses do? These are some blended competencies that nurses need in order to achieve those aims. First is cognitive. Cognitive is your thinking skills, like cognitive skills such as critical thinking is important for nurses. Technical skills. These involve the skills that we learn as nurses. These are specialized skills, for example, inserting a Foley catheter, inserting an IV, checking vital signs, performing a health assessment. All these are technical skills. Interpersonal skills. These are skills that involve developing caring relationships. Then you have ethical and legal skills. Now, these skills enable nurses to conduct themselves morally and professionally. More recently, these competencies have been further specified as the Quality and Safety Education for Nurses, QSEN competencies. What are the QSEN competencies? We have patient-centered care. We have teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Please take a few minutes to visit the QSEN website, where you'll find more information on these competencies. These are very important for you as future nurses to understand. And if you notice at Maricopa Community Colleges, you are evaluated based on these competencies. Let's talk about a profession. What is a profession? Right? Before we even talk about whether nursing is a profession or not, let's look at the definition of a profession. A profession is a field of work that involves a group of people who have specialized knowledge, skills, and training, and who adhere to professional standards and codes of ethics. Professionals are expected to apply their knowledge and skills in the interest of others and are held to higher standards than non-professionals. Now, looking at this definition, if you notice, I highlighted a few terms here. We have specialized knowledge and skills and training, professional standards and codes of ethics, and applying these for the interest of others. Now, think about it. If you reflect upon it, you will notice that all of these are the core definition of nursing. For example, as a student, you learn specialized knowledge. That's what you're here for, right? You go from block 1, block 2, block 3, block 4, then you do your NCLEX, and you get your license. So this is specialized knowledge that you are gaining. Skills and training. For example, the skills that you learn in your labs and at clinical practice, in simulation. And these are all technical skills and specialized skills that you are gaining to use in the future. Professional standards, to be adhering to professional standards and codes of ethics. Of course, in nursing, we adhere to professional standards and codes of ethics that are guidelines for our nursing practice. And finally, applying this knowledge and the skills in the interest of others. That is the core definition of nursing. That's what we do every day as we practice as nurses. We use the knowledge we've learned in nursing school. We use the skills that we learned in lab and clinical practice and simulation. And based on the professional standards and codes of ethics we follow, we provide care for the interest of others. Nursing education. Nursing education there are different types and different levels. You have practical and vocational. For example, you have a CNA, you have a licensed practical nurse. Then you have registered nursing education. That's the education that you are receiving right now. And after you're done, you will take the NCLEX and you will get your license as a registered nurse. Once you've got your license as a registered nurse, you can pursue further education. You can get a master's, which is your graduate degree in nursing. And it can be in different fields. It can be in education. It can be in administration. It can be in informatics, with the focus, in nursing. Then we have continuing education. This is education that we continuously gain for professional development. In-service education, this is the education similar to continuing education that that is provided by healthcare facilities to help nurses grow professionally. Let's talk about we talked about profession and how nursing qualifies as a profession. What are some important qualities that we as nurses should possess and are essential to our practice, crucial to our practice as nurses? First is critical thinking skills. You have to critically think about clinical situations. For example, like monitoring the client, noting changes, taking actions to ensure that the client is safe and you provide effective care, knowing the difference between normal and abnormal, and knowing when to act and how to act. All of this is critical thinking, right? Caring and compassion, how we are with the client and with the interdisciplinary team. Kindness, concern, sincerity. Those are the things that we should practice. That's caring and compassion. Detail-oriented, paying attention to details and to identify potentially harmful errors in the care we provide. Organization skills, being able to prioritize the needs of the most critical clients first. Speaking skills and listening skills, these are communication skills, and we will cover communication next week, but these are very important for us to have. And even listening and patience in stressful situations in the work environment, being able to think clearly and take the correct actions. Then we have competence, obtaining the knowledge and skills to ensure we provide safe, quality care to our clients. Then emotional stability, being able to cope with human suffering, emergencies, and other stress factors. Physical stamina, being able to perform physical tasks and endure long working hours, walking and standing, and just running around. Nursing practice, has been divided into different levels. You have the novice nurse, that's the beginning nurse, the nursing student, or any nurse entering in a situation where there is no previous level of experience. That is, for example, the new nurse, right? Advanced beginner. This is a nurse who has had some level of experience with the situation. This experience may be only an observation in nature. For example, you observed a skill being performed or a situation, and then you're faced with it again. It's not something that you have specifically been involved in, you have just observed it. Then you have competent nurse, a nurse who has been in the same clinical situation, position for 2 to 3 years. They understand the organization and specific care required by those specific types of patients. For example, a nurse who has been working in the ICU for more than 2 to 3 years. So she has a lot more experience dealing with critical care patients, right? Then you have the proficient nurse. This nurse is, perceives the patient's clinical situation as a whole, is able to assess the entire situation. And they focus on managing care as opposed to managing and performing skills. Then we have the expert nurse, a nurse with diverse experience. So these are the different levels of nursing practice, Now the roles of a nurse. What role do we play as a nurse? There are different roles, and sometimes we play all these roles at the same time. You have the direct care manager. You provide total care. You use the nursing process to develop a plan of care and meet client needs. You document and record data in an organized fashion. You delegate responsibilities. Then you have the client advocate. You respect and uphold the client's right, ensure client needs are met, providing support to clients. Then we have the case manager. We have case manager will facilitate delivery of cost-effective care, individualizes care, coordinates care, applies nursing skills to achieve desired outcomes. You collaborate with the healthcare team. Then we have the educator, the client family educator. We teach our patients about medications, health promotion, literature. We refer them to reliable websites where they can get information. We refer the client to the appropriate resources, and we incorporate good communication. And like I said, as nurses, we play multiple roles at the same time. For example, while providing direct care, we're also advocating for our patient or teaching our patient. In chapter 1 on table 2, there's a list of roles that a nurse plays in different settings: the caregiver, communicator, teacher, educator, counselor, leader, researcher, advocate, and collaborator. Please go over this table in your textbook. It's very, very important for you to know this. Guidelines for nursing practice. What guides our practice? These are they're organizations, as we mentioned earlier, that guide nursing practice. That's what qualifies it as a profession. So basically, standards of practice, the Nurse Practice Acts, codes of ethics, the nursing process, and other clinical judgment models. Standards of practice, they're basically a legal scope of nursing practice, and they define the important terms and activities in nursing, including legal requirements, titles for registered nurses and LPNs. They establish the criteria for education and licensure of nurses. So if you please take some time and go to the ANA website, the American Nurses Association website, where you can find the standards of nursing. The Nurse Practice Act. The Nurse Practice is basically, each state has enacted its own Nurse Practice Act, which is a compilation of laws that govern the practice of nursing. So basically, the Board of Nursing is responsible for defining the practice, establishing licensure criteria, developing rules and regulation to provide the guidance, enforcing the rules that govern education and nursing practice. And to practice nursing, you must be licensed as a nurse by the Board of Nursing in the state that you will practice in. Important nursing organizations. We have the American Nurses Association. Then we have the National League of Nursing, International Council of Nurses, National Standards, American National Student Nurses Association, Then we have the Sigma Theta, and then we have other specialty organizations that are basically specifically for a group. For example, you have the Emergency Nurses Association. So please review this table. It's very important for you to go over this, and also read chapter 1 in your textbook, which will provide a lot more information, as these PowerPoints only cover the key concepts, and your chapter reading will help enhance your learning and help you to understand what we are going to be covering.